From the Cincinnati Children's Hospital Medical Center, Julia Elkus and Michael Marcotte. Dr. Michael Marcotte.
Avondale is a community in the heart of Cincinnati, Ohio. It's the home of Cincinnati Children's Hospital Medical Center, and from the treetops, it looks like a charming neighborhood, a good place to raise a family. But when you get to street level, you see something quite different. In fact, Avondale is an urban neighborhood that is plagued with one of the highest crime rates in the city. It struggles with chronically high levels of unemployment. And over 50% of the children in Avondale live in poverty, a number that continues to grow. This is in sharp contrast to Children's Hospital, ranked number 3 in the country and a leader in world-class care. We have children who travel from around the globe to see us for our innovations and our world-class solutions. Our researchers are on the cutting edge of discovery and innovation, and we are tremendously good at saving lives. Yet we are not saving the lives of children in our own community. The infant mortality rate in Avondale is almost twice that of the national average, driven by a prematurity level that is 1 in 4 of every births in Avondale. Our medical experts have struggled with this, but found no solutions. Our community leaders have implored us to do better. They have asked us to get out of our institutions, to meet women where they are, and to listen in new ways to find a new way forward. In response, we created Start Strong, an initiative designed to break down the silos between healthcare communities, our community leaders, and women and families. We recognize that meaningful solutions lie not with medical providers alone, but with women themselves, and that the place we needed to start was in listening better and meeting women where they are.
And this is Alexis. She's one of the moms in our community. She told us about her life in an extended interview. She told us about her past experiences in healthcare. She told us about her desire to be healthy. After many interviews with moms, we came together, healthcare providers, community leaders, and moms, to try to generate solutions. Our moms told us that their trusted health advisors were their family and friends, not doctors. They told us they didn't make meaningful connections with their doctor or in other situations with families. Alexis reminded us of the power of sitting down to a meal with family and friends, and the family neighborhood feast was generated. We're lucky in Avondale to have Gabriel's Place. Gabriel's Place is an organization that helps provide healthy food to families who live in Avondale. And they were excited to host the Family Strong dinners. After 16 months and much growth in our program, we've seen moms and healthcare providers, including some of our OB and pediatric residents, sitting down at a meal. We regularly have 30 to 40 people sharing a meal. We don't have an agenda, but rather we sit down together, get to know each other, and build connections. One feast several months ago, I met Lanika and her husband, and Lanika shared that she was having twins and she was due in 2 months. I told her I was an obstetrician at the hospital she was planning to deliver at. We talked about her fears and concerns, and about a month later, she went into labor. Just so happens that I was on call with some of the residents that she met that night at the feast, and we immediately recognized each other, and we remembered the encounter that we had had at the family feast. We talked about her concerns, and over the next 45 minutes, we welcomed 2 healthy babies into the world, and we all felt very good. These are some of the residents that went to the feast, and they shared that since starting residency, they often felt discouraged to change health outcomes because of all the difficulties their patients experience. The Family Strong dinners have helped them connect at a personal level with moms they work with and renewed their sense of hope. On a human level, connecting over dinner changes the care experience for families and providers and enables us to build the foundation of trust that can change outcomes for the better. The side effects for this initiative have only been positive ones.